Hello, and welcome to our YouTube channel. If you don't already know who we are one more step towards the cure. We're a nonprofit organization who collects money and donates it to research facilities who research for a cure for bone cancer. But what is bone cancer? Bone cancer is bone tumors that start in the cells of the bones and are called sarcomas. A cancerous tumor is a group of cancer cells that group together and destroy nearby tissues. This cancer causes bones to break down and become very brittle. People who struggle from this find it very hard to be able to do even the simplest things in life because they are always weak and in pain, but there are ways to treat it. There are many different treatments doctors use for people with this type of cancer. For a low-grade tumor, the primary treatment is surgery. For a high-grade tumor, there are a few different ways to treat it. There is surgery, chemotherapy, and radiation therapy. Surgery is the removal of the tumor and some surrounding healthy tissues during the operation. Chemotherapy is the use of drugs to kill cancer cells, usually by ending the cancer cell's ability to grow and divide. Radiation therapy is the use of high-energy X-rays or other particles to destroy cancer cells. Here are some causes of bone cancer. The cause of the bone cancer is mainly unknown. One thing that has been linked to the cause of bone cancer is radiation exposure. It has also been seen to be hereditary. There are still some studies being done today to try and figure out the cause of bone cancer and ways it can be prevented. Early signs and symptoms of bone cancer. Bone cancer has many early signs and symptoms that can help detect the cancer. Some symptoms, such as bone pain, swelling, and tenderness near the affected area, weakened bone, fatigue, and unwanted weight loss. Bone cancer stages. Bone cancer has 4 stages. Typically, stages 1 to 3 are not as serious. Stage 1 cancers tend to grow and spread more slowly than higher grade cancers. Stage 1, the cancer looks like normal bone tissue. Stage 2 is when the tumor is either a little bit smaller than 8 centimeters or slightly bigger than that. In stage 3, the cancer looks very abnormal. Stage 4 is when the tumor may be any size and could have grown into the lymph nodes. The cancer could have also spread into the lungs. Bone cancer survival rate. If bone cancer is localized in an area, the 5-year survival rate is about 60 to 80%. If the cancer is spread beyond the localized areas, the 5-year survival rate is about 15 to 30%. Frequently asked questions about bone cancer. What are the types of bone cancer? There are primary and secondary. How is primary cancer treated? There is surgery, chemotherapy, and radiation. Should you get a second opinion on bone cancer? Yes, you should. Thank you for watching, and we look forward for your future support in our case.